Hello all, I'm Dr. Neema Bhatt, Senior Consultant Hematologist, Bone Marrow Transplant Physician and Pediatric Oncologist. I practice at Fortis Hospitals in Bangalore, Mahavir Jain Hospitals, as well as Helios Cancer and Hematology Clinics in Bangalore. I'd like to talk about leukemia. So, what are the few things that general public should know about leukemia or blood cancer? And what is it that we as hematologists want you to know or be aware of when you're a patient with leukemia? So leukemia is nothing but, as I've spoken about in my other videos, it is nothing but blood cancer, and it can be of different types, and it can present in various ways. So I'll start with what are the different types of presentation and what are the symptoms you should watch out for leukemia. If you're an individual, anywhere in the age group of 20 to 60, 65 years of age, you are at risk of leukemia. Especially if you are above the age of 55 to 60 years of age, you are at a higher risk of this blood cancer or leukemia. So leukemia usually presents with symptoms of fever, reduced appetite, reduced weight, or sudden unexplained disproportionate weight loss, loss of appetite, as I said, pain in multiple bones or joints of the body, unexplained bleeding or bruising. So bleeding from the gums, bleeding in the nose, blood if you notice it in the in your stools, if you notice unnatural or abnormal bruising, which are bluish patches on the skin. These are usually some of the symptoms. Feeling excessively tired and fatigued, not being able to go to work, not being able to maintain your physical activity, these are most of the common symptoms. You can also present with leukemia with enlarged lymph nodes. So we have these lymph nodes which are nothing but soldiers that prevent infection from going to blood. They are located mainly in the neck, in the underarm area, or in the axilla, and in other regions. If you notice that in any of these lymph nodes are enlarged, that is one of the other red flags or symptoms which needs to be checked out to make sure that you don't have leukemia. So what do you do when you have suspicion or you have any of these symptoms, or you notice that you or your family member or friend has any of these symptoms? The best thing is to consult a physician or a hematologist. If you go to a physician and they also are alarmed by these symptoms and suspect blood cancer, they usually refer you to a hematologist. And what does a hematologist do? So how do we diagnose blood cancer or leukemia? So we usually start off with some basic blood tests where we see the counts of the patient. We see if there are any abnormal cancer cells floating around in the blood. We also put the blood under the microscope and see if there are any abnormal cancer cells. And we do a specific test called bone marrow aspiration biopsy, which is nothing but we take a sample from the factory of blood production, which is the bone marrow, which is usually located in the hip bone. And we send it off for some special testing called flow cytometry and cytogenetics, and a few other tests like FISH or PCR, basically to to diagnose which type of leukemia it is, and to also give it a risk. So is it a high risk leukemia, low risk leukemia? Because this is what will determine how we are going to treat that in the future. So this bone marrow aspiration biopsy, as I've described in my previous videos, is a very simple procedure. It is done bedside with local anesthesia and takes about 10 minutes. Most often the biopsy takes about 24 hours for it to be reported, and if usually there is a diagnosis of leukemia, the reporting is done much faster, so that treatment can be started as soon as possible. Of course, it is the job of a hematologist to start treatment. I will just tell you, in brief, that there are different types of leukemia. Most common of them are acute lymphoblastic leukemia, acute myeloblastic leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. These are the brief or general types of leukemia that we see. The type of leukemia you have usually varies from what age group you belong and what your presentation is. And once it's diagnosed, the treatment, of course, is very, very different for each of these leukemias. As a patient, what precautions does a hematologist want you to take? Because treatment part is taken care of by me, but at the same time, I want to make sure that as a patient, you have to be in a good shape, to continue to take treatment, and you should not fall ill and should not have too many side effects from the chemotherapy that we give for leukemia patients. So first thing is, anytime you have any suspicion, once you start chemotherapy, if you have any major symptom like excessive vomiting, excessive tiredness, recurrent fevers, feeling again achy or a lot of pains again, not being able to take your food well, the best thing is to contact your hematologist and make sure that that symptom is addressed as soon as possible. Why do I say this? Because once you start chemotherapy for leukemia, you become what we call immunocompromised. Especially the first 2 to 3 months are extremely intensive when we treat leukemias. and at this time your counts drop, which means your immune system is extremely low. So even taking a regular food that your friend or your relative might have, like from a regular pani puri stand, might give you an illness that may be life threatening, and it's very, very important for you to address it. That is one of the other reasons we also say try to avoid outside foods, try to avoid chaats, try to avoid meats that are cooked outside, even fish and either seafood or meats, because they're usually not cleaned thoroughly, and improperly cleaned food will lead to infections. Especially if you're in the first 2 to 3 months of taking treatment for leukemia, these are the things that you should make sure that you follow or be aware of. Avoiding crowds. Make sure you don't attend a very crowded wedding. Don't go to a temple, because most people are in a very anxious state of mind when they're diagnosed with blood cancer, and they want to seek solace by going to a temple or a special puja. We don't, of course, discourage you from seeking religious hope, but all we say is don't go to a crowded temple, or don't go to a crowded function, because that's when you expose yourself to infections. And that means that if you come down with a really bad infection when you're taking treatment for leukemia, it becomes difficult for the hematologist to continue treatment, and then that's not good for the outcome of the patient. Also avoid meeting too many people, because if somebody is sick and you don't know who you have met and what they had, then you might contract that infection. And once you get an infection, we'll have to put the whole treatment on hold and focus all our efforts on trying to treat that infection, and only then we can start to treat the leukemia. So avoid meeting people who are sick, avoid encouraging too many visitors from coming home, especially if they are sick, so that you keep yourself safe or away from infections. Apart from this, what is the treatment for leukemia that we usually do? As I said, as most cancers are treated, most leukemias are treated with chemotherapy. So chemotherapy is made up of intravenous. So we give the chemotherapy into blood. It's also made up of CNS directed, which means when blood cancer spreads, it usually spreads to the brain and the fluid around the brain. So we also have to give chemotherapy into the cerebrospinal fluid, so the fluid that circulates around the brain. We do it by doing a procedure called lumbar puncture and introduce the chemotherapy directly into the fluid that circulates around the brain. Some types of leukemia also require radiation, and depending on the age of the patient, if you're a patient who is younger than 60 or 65 years of age and is in a good fitness level, then bone marrow transplantation as well is used to treat leukemias. Apart from this, there are newer treatment modalities like immunotherapy, which is basically priming your immune system to start fighting the cancer by itself. There are also other modalities of treatment called CAR T-cell therapy, which is a type of immunotherapy. There is also now targeted treatment, which is used for multiple leukemias, so that we target that particular cell that is manifesting into leukemia, so that the outcomes can be improved. So these are all the most commonly used modalities for treatment of leukemias. How are the outcomes for patients with leukemia or blood cancer? So usually younger patients, as I mentioned, younger than 50, 55 years of age, if they don't have any other comorbidities, like if you don't have diabetes, hypertension, major cardiac problems or kidney problems or liver problems, the outcomes are better because your organs are able to tolerate chemotherapy well, and we are able to kill most of the cancer. But otherwise, older patients, especially ones that are older than 60, 65 years of age, most of those patients cannot tolerate as high doses of chemotherapy. We cannot do bone marrow transplants for them because their organs already are not going to be able to tolerate high doses of chemotherapy. We mostly treat them with chemotherapy or with sort of reduced dose or reduced intensity chemotherapy. In spite of that, patients can lead a very successful life with good outcome if they follow the protocol and make sure that they're in constant touch and they're following the instructions of their hematologist. This is my brief gist about leukemias. If you have any questions about leukemias, kindly make sure to reach out to Dr. Neema Bhatt, hematologist. Thank you.